Դուստրս ամեն օր քայլում էր իր սիրելի մայրիկի հետ։ Դա նրանց մեծ հաճույք եւ հրճվանք էր պարգևում։ Ցավոք սրտի կնոջս ախտորոշումը արյան քաղցկեղը վերջ դրեց այդ երջանկությանը։ Այժմ աղջիկս եւ ես պետք է քայլենք կնոջս համար, որպեսզի օգնենք ոսկրածուծի դոնորների հայկական ռեեստրը գտնել համատեղելի դոնորներ եւ որ իմ դուստրը կարողանա վայելել իր մոր կողքին մեծանալու բերկրանքը։ Միասին մենք կարող ենք փրկել հարյուրավոր կյանքեր։
Ոսկրածուծի դոնորների հիմնադրամի քայլարշավը տեղի կունենա մայիսի 3-ին ժամը 9-ին Գլենդելի Մեմորիալ հիվանդանոցից։
Բարև ձեզ սիրելի հայրենակիցներ, ես դոկտոր FRIDA Ջորդանն եմ, ոսկրածուծի դոնորների հիմնադրամի նախագահ։ Մեր աշխատանքներից մեկը, որ այս ծրագրում փորձում ենք իրականացնել, մեր ժողովրդին տեղյակ պահել տարբեր քաղցկեղների մասին եւ այսօրվա այն քաղցկեղը, որ կուզենք իր մասին խոսել, աղիքների քաղցկեղն է, colon cancer-ն է, որ շատ դժբախտաբար տարածված մեկ հատ հիվանդություն է եւ այս իմաստով մենք հրավիրել ենք մեր տաղավարում շատ լավ մասնագետ, որ ինքը աշխատում է եւ պատասխանատուն է բոլոր colon եւ rectal surgery-ների department-ը, որ գտնվում է Glendale Memorial հիվանդանոցում։ Ինքը ավարտել է իր ուսումը US-ի համալսարանի մեջ եւ արդեն 13 տարուց ավել է, որ այս բնակավարում իր մասնագիտությունն է իրականացնում։ Մենք խոսում ենք Dr. AnaMaria Garzայի հետ եւ մենք իրեն պետք է մեր խոսակցությունը շարունակենք անգլերենով։ Dr. AnaMaria, welcome to our program. I'm so honored and privileged to have you at our TV program because, first of all, you are a very professional woman that in this field, which I'm so proud to have you. And also, you are a very prominent specialist in our community at the Glendale Memorial Hospital. So I want you to talk about your establishment at the hospital. You are the director of a colon and rectal surgery department.
Well, we have a group of colorectal surgeons.
Okay.
And there's a group of 4 of us. We are all board certified colorectal surgeons. So in addition to general surgery training, we also have certification in colorectal. So we take care of colon cancers and a lot of other illnesses of the colon. So we're specialists of the colon and the rectum.
Okay.
There's 4 of us. We're all are a little different. So patients find us and we can take care of pretty much any patient and any patient's needs. Mm-hmm. I am in charge of a portion of the Colorectal Surgery Institute. We do have another doctor who's actually the director of the institute, but we all work very closely together.
Okay. So what is your main specialty, even in this specialized area?
We specialize in colorectal cancers.
Okay.
And I also, because I'm female, I tend to see a lot of women who have problems with control of their bowel movements and things like that. So I'm in charge of that disease process.
Yeah. By the way, I was your patient this 6 months ago. I did my colonoscopy at your establishment at Glendale Memorial Hospital, and you were my doctor. Probably you didn't recognize me because I was full asleep when you did the procedure. But I was very impressed with the new section that they have constructed, that department. Because it was very nicely done. I've never been there before, so I tried it. I asked my friend David Moss, who should I go to? And David said, AnaMaria Garza, that's it. You have to go to Dr. Garza. So I came to your department and everything was very nicely done. And by the time I realized I was home, so it was very nicely done.
Right. It is, the colonoscopy is a very nice procedure because you are sedated, so you're comfortable.
Yes.
And by the time you wake up, you don't even know it's already happened.
That's right.
So it is a very nice procedure. Most people are afraid to get it done.
Now, Dr. Garza, can you explain more about all the preventive things that we can do to avoid the colon cancer, or what is your general recommendations?
Okay, so colon cancer is a disease that we can actually prevent, and we can prevent it during the screening process, which is very different than prostate cancer, breast cancer. You know, in breast cancer, we get a mammogram and we can find things, but we can't intervene right away. With the colonoscopy, which is the best way to screen, we can go in there, and if we find a polyp, we can take it out before it turns into a cancer. So not only is it screening, we can also treat and prevent. So the guidelines are to be checked by your doctor on a yearly basis. That is, people are a little uncomfortable with that, but it's very helpful to get a rectal exam by your doctor. When you are 50, you should get a colonoscopy. That is very important. Whether you have
for men and women,
men and women. It's not a male-dominated disease. It's actually even men and women. 50 is the starting screening age. If you have problems like bleeding or pain or change in your bowel movements, then that should prompt you to get it looked at earlier. You don't need to wait till you're 50. Other things to be aware of is your family history.
Yes,
which is a very important thing. If you have a mother or father or a brother or sister that have had colon cancer, also uterine cancer or kidney cancer, we would like to have you screened earlier to make sure that you're not making polyps earlier that we could prevent for cancer.
Okay, that's interesting. So is there any genetic testing that they can do, like breast cancer? They can do this genetic testing to see whether you are prone to getting this cancer?
Right, there are some genetic testing. What we do is there's certain criteria for when a patient would get genetically tested. So if a patient comes in and they have a very strong family history, that is important to know because they may be a candidate for testing. If a patient develops a cancer that is when they're younger than 50, then we would genetically test them. If they become genetically positive, then we would test the rest of the family.
Okay.
So then we can determine whether family members are higher risk. So genetic testing is a good option, but you have to meet a certain criteria to get that.
Yeah. And what is the name of the mutation that you are looking for?
Well, there's a number of different types. There's, all of them are a bunch of initials.
Okay.
And it gets confusing when you start talking about the actual names. But what these mutations do is they cause a number of polyps, and they cause polyps at an earlier age. So we do look at specific genes, and if those genes are positive, then we test the patient for those specific genes. We can really change people's lives by identifying if they have a genetic problem, because we can catch things much earlier by looking at them earlier.
Oh, that's wonderful. Now, what happens when you diagnose a patient with colon cancer? I'm sure there are different stages. So can you please let us know that what happens at stage 1, stage 2, stage 3, stage 4, too far gone? So what are the steps after diagnosis?
Okay. So staging is very important to us. It helps us understand how we need to treat you and what to expect. So stage 1 and stage 2 are the earlier stages. When you're stage 1 or stage 2, we feel a little bit more comfortable that the tumor is stayed in that location in the colon. Stage 3 means that some cells may have escaped and we see them in the lymph nodes. And then stage 4 is it's gone to another organ. The amazing thing about colon and rectal cancer these days is that the treatment has changed the outcome dramatically. We see patients that come in with stage 4 cancer and we treat them with chemotherapy and their tumor melts away. So it's not necessarily a cancer that people need to die of anymore. We have great treatments and the outcomes are better than they were 5 years ago and much better than they were 10 years ago. So we see patients that are very young that have stage 4 disease and they end up getting cured. So it's something that shouldn't be feared. The earlier we catch it, of course, the better, but some people are reluctant to get tested because they're afraid of what would happen if they do have a problem. But it's a very treatable disease.
And the treatment is chemo, or you do radiation, or you do surgery? How do you deal with it? It depends.
The colon and the rectum it's our specialty, and they're grouped together, but they're very different. So if the cancer is in the rectum, then we usually treat with chemotherapy and radiation first, and then we do surgery. If the cancer is in the colon, we usually treat with surgery first. Then we see what the pathology shows, see if there's any evidence of lymph node spread, and then we decide if the patient needs chemotherapy. But a lot of times the surgery is curative and we don't need to do any additional treatment.
Even at stage 4?
Stage 4 is different.
Yeah.
Stage 4, they usually get chemotherapy first, and then once we see that they're responding, then we do surgery.
Yeah.
So, but usually the stage 1s and sometimes the stage 2s don't get chemotherapy.
Oh, that's nice.
So the earlier the better.
Yeah, yeah. That means that they don't get poisoned because of the chemo.
Right.
It's more tolerable, yes?
It's tolerable. Yeah, the chemo is poison, but the reason why it's poison is because it's killing cells.
Yeah, the normal cells.
Yeah, it kills some normal cells. And the reason why some people lose their hair or things is that it kills rapidly growing cells.
Yeah.
So we know that tumor cells are rapidly growing, so we're giving it medication to kill the rapidly growing cells, and with that comes hair and things like that. So, but it's much more tolerable than it was before. Patients work and they're on chemo. A lot of them, their lives are just as they were before. There's chemotherapies that are pills, not necessarily in the IV. So it's much more, it's easier than it was in the past, and it has really good outcomes.
What kind of symptoms people need to be aware of, rather than cramps and you know, different? Well, normal constipation doesn't mean that they are going to have a serious consequence, but what kind of a symptom you would say, if you have these symptoms, be more careful, go and check it out? Yeah,
we describe, when we talk to patients, we say anything that's different.
Yes.
So if you're someone who has constipation for 20 years, you know, and the constipation's the same, we don't get as concerned. If you're somebody who's been completely regular, and then all of a sudden has constipation, we get a little bit more nervous about that. So we look at change in bowel habits. Any bleeding needs to be looked at. Most people, or a lot of people say, oh, it's just my hemorrhoids.
Yes.
And they don't get checked. And that's the problem, is that, yes, most of the time it is your hemorrhoids, but there are times it's not. And so when you've already started bleeding, we get concerned and we need to intervene faster. The reality is that you can have a problem and have no symptoms. And that's most of the time what happens. So that's why the screening colonoscopy is so important.
Colonoscopy is very important.
Very important.
Yeah, that's very good. Dr. Garza, nowadays there is a lot of advertisement on colon cleansing diets and whatever you can drink to clean your colon. Is this good for your colon? I mean,
this is a question we get often. And the cleansing of the colon is not necessary. Most people feel like it's a healthy thing to rid their body of the stool. Your colon was made to do that job. So it will hold on to stool, and that's a normal thing. So you don't need to cleanse your colon. Now, a lot of times the cleansing is very irritating to the colon, and that can give you more problems. So we usually tell the patient, just high fiber diet, your colon will be fine, and don't waste your money on the colon cleanses.
So you don't look better cosmetically?
You don't look better. You don't lose weight from a colon cleanse.
Yeah, if you want to do it, yeah.
Yes.
Yeah. Is there any kind of a diet that you would recommend for people to adhere to for avoiding this situation?
Right. We always say high fiber diet, and that's more than just vegetables and fruit. Adding fiber with either Metamucil, Citrusol, something over the counter is the best way you can go, because you know you're getting your fiber and you don't have to worry about getting it in your diet. The studies have shown that adding fiber to your diet actually decreases the amount of polyps that you form. So, and we think polyps can turn into cancer, so if you decrease your fiber, you may be decreasing your risk of cancer. The other thing is red meat has been shown to have some correlation with cancers, and also alcohol has been shown to have some correlation with colorectal cancer.
Okay. And exercise would help?
Exercise is always great.
Yes.
Exercise is great.
Yeah.
A lot of the cancers that you can have correlate with obesity.
Yes.
So we see that as the country becomes more obese, the number of cancers increase. So the less obese the population is, we think the less cancers that will develop. So that is an obstacle. But yes, exercise, even half an hour, 45 minutes a day, does improve your risks.
45 minutes a day.
Yeah, that's tough. I'm not saying I could do that either, but it's
that's a tough
it's a goal.
figure. Yeah, that's nice. So, but I think it should be on everybody's wish list.
Yes, exactly.
Yeah,
yes.
yeah. The one thing which I made myself do after each after lunch, which that's what the seated meal that I'm having. I made myself to walk for 10 minutes after lunch.
Yes,
you know,
that's a great idea.
Yeah, I mean that's a kind of a habit that I'm pushing myself to build in. You know?
That's great for your metabolism, and it doesn't have to be half an hour, 45 minutes at one time.
Oh, that's better. Yeah,
that's better. Right.
Throughout the day.
Throughout the day.
Yeah.
Just lead a more active lifestyle.
That's right.
Is
always
better.
Less sitting. At the hospital, you are dealing with a lot of Armenian patients. I am guessing.
Yes.
Are they very difficult?
No, actually, the Armenian patients that we see are great, and they are thankful, and they listen and understand, and yes, it's been great. I haven't encountered any significant difficulties.
to an Armenian patient, if you say you cannot eat red meat and alcohol,
right.
You know,
they don't like that.
That's a tough one, especially the male patients. Yeah.
Yeah, I think the hardest thing for any culture is overcoming the stigma of having a colonoscopy or having a rectal exam. My grandmother was 85 and never had anyone do a gynecologic, a woman's exam, or a colonoscopy. She started having bleeding or blood in her stool, and she kept it quiet from me, and this is what I do.
Yes.
And so she was modest. We ended up doing a colonoscopy, and we found a problem. And, you know, it's hard because if she wasn't so modest and so worried about it, we would have caught things earlier.
Yes.
Now, people get very embarrassed about it. And I always tell the patient, if we do a colonoscopy and it's normal and you have no risk factors, we probably don't have to do another one for 10 years.
Yeah.
If we do something and we do a colonoscopy and find something, you'll be certain that we will be doing it much more often, maybe every year or every 6 months. So there is a huge benefit of doing it early before we run into trouble.
You'll get less embarrassed.
Right. So modesty, and the reality is nobody is looking at you. Nobody is criticizing you. Nobody is saying anything.
Yeah.
And actually, people are saying that person's doing the right thing because they need a colonoscopy, and I need one too. That's what most people are saying.
Yes. Well, I'm glad that it's becoming more common. I'm glad that people are taking it more lightly, that this is what needs to be done. And I'm very happy that it's done under total anesthesia.
Yes.
With a lot of warm blankets, I enjoyed.
Right, warm blankets and... Right, you go home, you can eat food as you were before and continue on your way.
I was ready to go to work,
right.
You know, but I took a day off.
Yeah, I have to take a day off.
That was a good excuse, but you know, but I was ready to, it's absolutely no, I didn't feel any side effects. Probably I'm tolerating total anesthesia, because the side effect is more from total anesthesia than anything else.
It's just being groggy. It's not quite total because you're not on the breathing machine, but you're in a twilight.
Yes.
But most people don't remember any of it.
No,
at
I
all.
don't. No.
So
I'm glad I didn't remember any of it. Yeah.
The hardest part is the cleansing process.
Oh yes, that I didn't like.
That is the hardest part. There are a couple of new bowel preps that have recently come out that are smaller version and don't taste as bad.
Yes.
That makes it a little bit easier.
Yeah.
But
that's the difficult part.
Right.
You're absolutely right. Yeah.
Right.
I mean, I hope that in future they'll come with something better.
Better. But you get to do that in your own home.
Yes.
And after you get through that, then the rest is easy.
That's good.
Right.
Well, you know, it's very, very important for us to know, especially for our people who are watching this program, that at their doorsteps, I would say, because Glendale Memorial is very close to our community, is in the community, we have the best center, and this is I mean, you are being specialized in this field for the last 13 years, and you have so much experience with your colleagues, and you can give the best service, and they don't have to go to Beverly Hills and all that far places to have their colonoscopy done or their surgery done. I mean, that's very comforting. That's very comforting.
Yeah, I think our group is different than a lot of the groups because we are very academic. We're involved in research still. So we're an academic place in a community hospital. So while we can do the latest procedures, we do the more advanced colorectal procedures, we do a lot of things that would otherwise go to the universities in the community, which is great because people can stay close to home.
Absolutely.
And we're there to take care of the patient. So it's a lot of personal care, which you don't necessarily get when you go to the big university hospitals. So we're a little bit unusual in that respect. And the hospital is great. The nursing staff is great. And even a screening colonoscopy, you could call the office, we schedule it, and we do everything over the phone. You come in, and so you're really only missing the day of the colonoscopy from work. So we try to make it as convenient as possible so that the patient could get through the process and not impact their life so much.
Yeah, everything is so streamlined.
Yeah, very
everything,
streamlined.
it was very streamlined. Even they sent the prescription online, you know, what I'm supposed to do the night before online, everything is online. So, that was very nice.
And if
very
there's
nice.
any question, then even after hours, you call our office and you get one of the doctors. And we can explain things again and talk you through it. So we try to make it as easy as possible.
Yeah. And I think we are very happy to have that service at our doorstep. Thank to you. And well, I wish all the best. Now, is any more advices you want to give to our public, Dr. Garza?
I think that the most important thing is to be aware of their body, try to lead a healthy lifestyle. But even if you lead a healthy lifestyle, you still can have problems, and don't ignore it, because that's the easiest thing to do, but the hardest thing to recover from if their problem develops. So really be aware of your body and don't be afraid.
And don't ignore your...
Don't ignore.
Not normal symptoms, I would say.
Right.
Yeah,
it's so easy to get in your regular life, taking care of your kids, taking care of your spouse, going to work, and really not stopping to take care of yourself. It happens to everyone. Yeah. So it's very important.
That's right. Yeah. Well, I'm so happy that I had the chance to meet you in person. This time I'm awake, fully awake. And thank God I don't need to come back to you because I am off from the list for a while.
For a while.
Yeah, but I have been fully recommending that center to everybody. I used to go somewhere else, which I'm not going to mention, but now I'm going here because it's very close, very convenient, and and I don't have time to travel.
Right. So
this is my first choice, and I wish you all the best.
Thank you very much.
Especially you being a mother, a woman, and a very in a very complicated position. Treating a colon cancer is not easy.
Right.
I'm sure you deal with a lot of elderly as well as young people from different generations, from different cultural backgrounds, because Glendale is a community hospital and it deals with different cultures.
Right.
And I wish you all the best.
Thank you. Thank you for allowing me to come today.
You're most welcome. Thank you very much for coming. Սիրելի հայրենակիցներ, ես հույսով եմ, որ դուք որոշ բաներ սովորեցիք այս ուղղությամբ։ Եթե հավելյալ հարցումներ ունեք, խնդրում եմ մեզի զանգեք կամ իրենց զանգեք եւ իրենք բոլոր ձեր հարցերին կփորձեն որ պատասխանենք։ Մինչեւ գալ անգամ ստեյշուն ձեզ։
My wife would walk with our baby every day. They both loved it. But leukemia stopped my wife from doing the thing they loved. Now, my daughter and I are going to walk for my wife. To support the Armenian Bone Marrow Donor Registry, find a match so that my little girl grows up with her mom.
Please join us on May 3rd. Together, we can save lives.